Board of Commissioners, as the governing body of Clatsop County, all county service districts for which this body so acts as the Clatsop County Local Contract Review Board is now meeting in regular session. Please join me for the flag salute. I pledge allegiance
to the flag of the United States of America,
and to the republic for which it stands, one nation, under God,
indivisible,
with liberty and justice for all. May I have the roll call, please?
Commissioner Nevertheless. Here. Here. Commissioner Lee.
Here.
Commissioner Sullivan.
Here.
Commissioner Thompson.
Here, barely.
Okay, tonight's agenda, I want to make one small change. I would like to reverse the presentations. One of our guests is arriving a little late, so I want to reverse our presentations and put 4B in A and A in the B. And so other than that, I would look for a motion to approve the agenda, amended agenda, switching items 4A and B.
Mr. Chair, I move the adoption of the agenda as you've just amended it.
Second.
We have a motion and a second to approve the amended agenda. All those in favor? Aye.
Aye.
Opposed? Motion carries unanimously. We have a presentation tonight. Our first presentation is Cascadia Rising After Action Review. Good evening, Tiffany Brown. Welcome.
Thank you. Okay. Good evening, Commissioners.
Good evening.
It's been a little over a year now since we conducted Cascadia Rising, which was the full-scale exercise across the Pacific Northwest Region 10 to test capabilities of local jurisdictions, state level, all levels of government. And so tonight I'm before you. It takes a while to collect all the reports and all the after actions from all the levels of government. I don't think FEMA had theirs finished until January of this year. Other counties were kind of waiting to see, what the state produced. And so tonight I come to you with kind of a compilation of what we came through with. We came to conclusions and summaries. We sent them up to the state. They came back down in a report. And so I know some of you weren't here last year and are less familiar with this. I'm going to spend the first part of the presentation going through reviewing some of the slides we went through last year, just reminding you what the exercise was about, ending with some that are kind of text heavy, but that was with the intention that when you're done, you'll look over the recommendations because they're sort of a moving forward and planning our future food for thought. So why exercise? When we say exercise, what that really means is that we take a plan we have and we build a scenario and then we test the plan and we run through the scenario and we say, do we do it like our plan says we do? Should we do it a different way? Is there a better way to do it? And that's what we did with Cascadia Rising. The purpose, the goal of the exercise was to improve Emergency Operations Center's abilities to manage responses. Emergency Operations Centers at the local level, the state level, and the federal level. To focus on joint operations and include collaborative problem solving and information sharing across all levels of government. The outcome was major findings documented in after action reports that we use to make future improvements in planning, organization, and the other areas of our programs. It started in February of 2014. It was kicked off just across the river at Ocean Shores. Leaders from all 4 states came together to identify their top priorities and capabilities. What are the most important things that we need to have solid to respond to a Cascadia event? And they polled, but miraculously, they asked them for 5. The entire group continually identified the same 6. And so they went with 6, and here's what they were: critical transportation, mass search and rescue operations, operational communications, coordination, and public health and medical services. So they said, we'll go with 6, since there was such consensus about what the vulnerabilities were. Shortly after that, they created an exercise scenario document. The state's been gathering a lot of data on the effects of the Cascadia in the last 5 years, and so they pulled it, and the communities that will be impacted. This is just an example of one of the pages that would show you, what percentage of survivability ability they were expecting for different critical infrastructure facilities, how many people that you think, and we used this data moving forward to start planning the exercise scenario. And I won't spend much time on this, it just kind of gives you an idea. At the county level, we had 2 tracks. We were working with OEM and FEMA on the bigger exercise that started in November of 2014. And then at the local level, in June of 2015, we started conducting exercises at the local level, or planning meetings for the exercise, rather. And this is just a fancy graph that the federal government came up with to show how many people were participating. And I've got a couple other slides that show it in different ways, but you can see 3,500 players altogether across the 4 states and 70 emergency operations centers. Yeah.
Tiffany, I noticed 22 of the 36 counties in Oregon participated. Was there anything you can draw from that? Was that mostly that didn't participate? Was that, oh, here we are right here, never mind.
Yeah, so you can see a lot of central and eastern counties didn't participate. There were different reasons. We had participation issues even at the local level. We had a robust exercise, but one of the main problems here on the coast was the timing. It was the first week of June. It's the Rose Festival, it's graduation, it's what isn't it? And so, our first responder agencies are gearing up for the summer. Seaside's already feeling like it's summer. And so it was like, who thought of this date? So that was a lot of what I heard, particularly on the coast. Some counties further east are just slower to kind of, I think, get the memo about Cascadia and what an issue that will be for them. And I think we've even seen articles in the paper in the last year, if you saw the series about the Eastern Oregon series on, here's what it looks like for people in the east. So that awareness level is raising everywhere.
So let me just point out, if I may interrupt. You see Gillum County, which is a county that did not participate. Judge Schaefer from Gillum County is the co-chair of the Association of Oregon Counties Resilience Subcommittee, because what we're looking at is how do we partner with those Eastern Oregon counties so that even if they are our rescuers maybe in terms of Cascadia, we help them when it comes to wildland fires, because they've already had a massive wildland fires.
Right.
So somebody's the problem, somebody's the solution, no matter what the issue is, and we're all in this together. So noticing that, I think that would change maybe next time.
Here's what our local participation looked like. We had a lot of agencies and people come out and participate and work together on this exercise that hadn't before. It was really unprecedented. It was the first time we'd done a county emergency operations exercise where we talked specifically to the cities and the state. Typically, we're kind of talking to the state, and so.
And you had the ham operators.
Yeah, they're called Aries Races here. They're in that first column.
What is ORVOD?
Or VOAD is VOAD is Voluntary Organizations Active in Disaster, and Oregon is or VOAD is the Oregon chapter of that. It's the umbrella agency that during a disaster houses Deseret Services, Catholic Relief Services, all the denominations, Lutheran Family Services. Everybody brings a little different something to the table, and so or VOAD is that umbrella for those
I
services.
don't see the CERT teams on here.
There wasn't really an operational component to it. We had a couple CERT volunteers that helped out in the Emergency Operations Center. But in order for the CERT teams to participate in Cascadia Rising, one of their sponsoring agencies, a police or fire department, would have had to participate also. And it was primarily an Emergency Operations Center exercise.
I gotcha, I see.
Yeah.
Okay.
But Chief Skirmerhorn is very interested in Cannon Beach, and he's reaching out down to Arch Cape and Cove Beach and all that, and using the certs in a variety of ways. So again, maybe that'll change next time.
Yeah, yeah. And Cannon Beach was a big participant. It just wasn't that full scale, boots on the ground, practicing saving lives. Not for us. But that leads to the next slide. A unique aspect of this exercise for Clatsop County, it was primarily an EOC exercise for all the other counties, but in Clatsop County, because we have Camp Rylea, and because it was all levels of government, we had Title 10 and Title 32, which are the federal and state military resources, come to Camp Rylea in the numbers of about 800 or 900 and practice what they do during a disaster. And so I won't get into the weeds on these, but these are special teams that specialize in decontamination, search and rescue, engineering, moving roads. 3 of them are just teams that come in when you have that many people to manage those teams. And so it was a little notionalized that we pretended they were already here, and oh, lucky us, they're already here, and the earthquake hits. But it was a good exercise, and it helped us understand what they would be doing for us. I don't think everybody really understood how we got from here to there with the military, and this provided a much better picture. And then one of the things we did that was unique beyond that was that we took activities off Camp Rylea. They worked with the hospital, they worked up at the middle school, flying patients in and out. They did some flyovers in Arch Cape. They set up a casualty collection point at the airport. So that was unprecedented. We've done exercises at Camp Rylea. We've done exercises with all levels of government, but never before have we kind of sent them out into the community to actually start working with the community.
Tiffany, I'll wait.
Are you sure?
Well, I know the AOC training that we had in November, they were talking about reaching out to people in the community that would be helpful after, and one of them was the vets, because they
Yeah.
have so much experience,
Was that Jenny Damaris?
probably, yeah.
Yeah.
So,
And so the most important outcome in our minds is the after-action report. And an after-action report is the product after an exercise, and it's the thing that really makes it valuable for you. The exercise cycle is a constant cycle of improvement. And so I'm going to talk to you a little bit more about what that means. Our timeline of play, the full exercise was 4 days long. We played 4 days, but we only fully activated the EOC for 2 of those days. And for the remaining 2 days, we just remained on site to be support for the military and all the other partners that were out there exercising. They were still exercising as though they were responding in Clatsop County. So we kept our ham radio operators on site, and we took their requests and we passed information back and forth. But that was kind of the extent of it, was radio communications. And so an exercise program, in short, we abide by a Homeland Security exercise and evaluation program. It's very prescriptive, and it's a cyclical program. And without, again, getting into the details, it works like this. You have a plan. You plan an exercise to test the plan. You look at your summary and findings. You find out where the gaps and the vulnerabilities are, and you either modify the plan or modify your practices. And then you change the plan and you do it all over again. And it's the way that we test our plans and find out before things happen if they're going to work. And so here's the executive summary from the after action review, that in 2014 we undertook the responsibility of putting on this exercise. It was multi-state functional, and it tested these 6 areas. The exercise identified many areas for improvement and was viewed as a success to align future financial and administration processes with agency priorities. Subject training and exercise should focus on continuing to build coordination capabilities and streamlining the resource requesting process. And here's what that means. This is really about getting stuff when you need it, when something happens. And it's all about making requests and getting that information back and forth. And that's really the one thing we need to continue practicing. The language about the future financial and administration process, that means document what your findings are, so when opportunities come up, you can say, look, this is what we discovered here, here's what we need money for, and that's what gives you strength in applications for finding that funding.
isn't that also really important in order to get money back from FEMA and whatnot, to do the asking in the right order and as soon as possible? And
during a disaster.
Right, the practice, oh, I need this and I need that.
It's all part of the program. It's all designed to be a comprehensive program to continually improve your agency's program.
Could I just hold on that for a minute? Because Tony Hyde, Commissioner Hyde from Columbia County, repeatedly said that the problem that they had both in Vernonia and Columbia County was that they thought they had gone through the proper procedures to get reimbursement from FEMA. They found it very difficult. So he left everybody at the Association of Oregon Counties very nervous about, were we ready? Did we have the proper documentation procedures in place so that we could not only get the stuff, we could get paid when we needed to, because otherwise we're left holding the bill. So where are we with that?
Well, that's a big question, and I would want to understand more about what he was speaking to before I answered it, but we understand how the process works, and it's just a matter of, like you said, Michael Summers has done this most recently with, and he said it at the after action review, the documentation piece is really important, and it is it's not complicated, but it's something to know in advance.
It's detail oriented. Well, certain things like, there's something about using the right size pickup truck, what's authorized and what's not. I mean,
That's all National Incident Management System, that's resourcing, and that's a completely different area, but it's all back to the National Incident Management System. Thou shalt keep track of your resources in this way, and you shall categorize them in a certain way so that when the paperwork comes through, it's an auditing process basically in the course of providing reimbursement.
so basically, have we kept an adequate inventory system in place so that we know what we have and the value of what we have, so that if we lose it, we can
We have one in our emergency operations plan, and it's updated every year when the budget gets updated.
Good.
So here was the scenario. It was the big one, a 9.0, ground shaking for 5 minutes. We didn't really figure aftershocks into hours, but that's what we were given. And so here's the after-action methodology. You assess the local performance from a local perspective, incorporate generalized findings that affect local government, and analyze the exercise results, and then identify strategic areas for improvement. And then once you've identified those areas, develop tactical actions to be implemented to fill those gaps. Again, here are the 6 areas that we tested, and I put the asterisks here. These aren't something we just pulled out of thin air. The federal government and the National Preparedness Goal cites 31 core capabilities that they look to determine the readiness of a program. The data collection for the exercise came from 5 places. We had participants fill out a survey. We did a hot wash review the day after the exercise. We had part of the exercise process is you have planning meetings throughout and you take minutes and notes, so we used those. Design team observations that happened during the exercise, and then an after-action review meeting with exercise staff. We collected the information, analyzed, summarized it in findings, and then created a tactical list generated to attend to and try to achieve those strategic recommendations. And so I'm not going to spend a lot of time on these. This is the lots of text that I referred to, but these are the 7 strategic observations established by the state as a result of everybody's after actions going up. This is the 30,000-foot level of what really every jurisdiction reported on some level, and then the recommendations that came back out from the state. Now, we have a list of observations and whatnot that were captured at the local level, that were sent to the state level. And those won't be necessarily captured in these observations tonight, but I'm going to give you a few examples of how our observations likely contributed to these. So current emergency planning is not adequate or comprehensive enough to effectively address catastrophic disasters and their impact on the whole community within Clatsop County. I think we all knew that going into it. And so this one's maybe a little obvious. We need to do more. And so the second is, it kind of struck me the same, where it's significant risk, and that we need to continue focusing on region-wide preparedness, which Commissioner Thompson referred to earlier. And this is broadening our relationships, broadening our considerations, and thinking outside the box, quite frankly, looking at different mechanisms. Number 3, government at all levels is ill-equipped to implement effective continuity of operations. That means, how do we keep running as a government after this happens? Because that needs to be happening in order for us to respond to the needs of our community. And this wasn't something, COOP wasn't something we tested specifically, but overall the exercise is testing our continuity of operations. And so the recommendation is for governments to start looking at that. And I think I shared with you recently at a goal-setting session that the county did kick off continuity of operation planning earlier this spring. Current approach to catastrophic event preparedness at various levels of government are in need of increased dedication of local, city, tribal, and county government. If you think about it, these slides really all say the same thing in a different way. We all need to be working together more, better, bigger, smarter, and developing that bigger voice. This was based on the communications objectives, and it's what we discovered. This is an area where we fared really well in Clatsop County. Amateur radio is a challenge for some counties, not for this county. It is the thing that we actually are known for having a really robust program with. Does it mean that we didn't also have gaps and vulnerabilities and identify areas of improvement? Absolutely not. We found things here at the local level that we could improve on as well.
Do you think,
Go ahead.
do you think that helps because we have Clatsop Community College that offers that class up there?
I'm sorry.
Don't they offer a class for CB?
That's Roxanne and Jeff Holwig and Hal Dennison who
Mhm.
volunteer.
No, that's just where they have it.
Oh, okay.
Most communities have something like that.
Okay.
Yeah.
There are other ham volunteers who also teach.
We had quite we had a disaster in '07 with the big storm. And I think that the ham radio played a big role in bringing the community together there. And I think that, could I agree that one of the reasons Clatsop County has built some of this based on some of those experiences from the '07 storm, right?
Absolutely. In response to 2007, I heard a figure once that in the year following the 2007 storm, 600 people in this county got their ham radio license. Now, what they did with it afterward is another conversation, but we really saw the value of ham radio. I was a 911 dispatcher at the time, working part-time in Seaside, and we couldn't communicate outside of Seaside, and the ham radio operator came in and sat in the break room across from where I sat and passed traffic to Salem and to the county. And I think it was really the first opportunity for people to say, oh wow, these guys really, when you need them, you need them. Yeah.
I have one more question then. Maybe you could answer this for me, Leanne, because you're involved in the ham radio. Is it possible that we could have too many people? Is that
Trying to talk at
'cause
the
when I
same
think,
time?
you get 600 ham people when a disaster occurs, and I'm sure that's been addressed.
Well, it's human beings, isn't it? Because that's really, it's the, what do you call it, self-referred volunteers, whether it's Red Cross or ham radio or whatever, people want to help. So hence what,
The hams have a saying, a term
don't say it.
called termite hams.
I hate that.
And it's the people that you never hear from until something happens. And we do have conversations about, so what if 600 people got on their ham radios? If they knew who to call, would they all, So in answer to your question, part of the training is understanding the protocol and the etiquette and whatnot.
So let me just talk about what goes on at the community level. It's mostly how to stay off the ham radio bands during an emergency. I think you saw in here the FRS radios. So the idea is how do community members who are concerned communicate within communities using the FRS radios, the little yellow radios, then manageable ham traffic. And that's really where your exercises come in. Also, I'm not technically electronically oriented, but gradually, both nationally and locally, the ham radio community is saying, oh, we can't call them termite hams because the hobbyist ham radio people are aging out. These are the people who want to build something. No, we have people who want to use a ham radio the way it's a cell phone. And so the ham radio, the Sunset Empire Amateur Radio Club, which maintains the repeater system, the link to the outside world, we're starting to shift now to look at how do we deal with people who just want to use the instrument, who are not the hobbyists, who are the people who want to be useful in case of an emergency. So I think we're in the process of that shift, and we'll look forward to working with you. But you've really highlighted the essential point is we don't want everybody on there because it'll just be a mass of confusion. It'll be a can of worms.
Yeah.
That's the issue. So if you want to learn how to use a little yellow radio, I'll bring those in next
I know
time.
how to use them.
There you go. All right. So can I just shift a little bit? You've talked about all these issues. My question is, what are we county commissioners supposed to do? Should we all have yellow radios? Do we all have yellow radios? What's our function during an emergency? Because I want a sheet of paper that tells me what I do. I like
That's a
written
different
stuff.
conversation, and one we'll probably have when we review the emergency operations plan.
Cool.
Great. Strategic observation number 6, local EOCs are not equipped, not staffing-wise, not structurally, to provide the level of sustained emergency management required in response to a catastrophic event. Nobody has enough trained people. Nobody has enough positions trained deep enough to sustain those extended operational periods. And so the recommendations are what we already knew. We need to train more people. We need to have a more robust system for getting people trained to work in the Emergency Operations Center. And the last observation, current relationships need to be cultivated to effectively integrate more of the local community. And you see in the recommendation, it's very vague, and you see in the recommendation, you can kind of start to look at where this came from, and it's that we're all used to working in our siloed environments, and that works for us most of the time. And I personally don't think silos are all bad. It's where we kind of cut our teeth and get better at what we do. But when things get bigger, we can't afford to be working in silos, and I think that's what this recommendation speaks to. So what do we do with all of this? We built something called a tactical improvement plan, and we look at the 7 strategic findings, and we look at them sort of across the 4 areas of emergency management, preparedness, mitigation, response, and recovery. And we look at the findings, the suggestions, the participant feedback forms we got, and we start developing ways to address those gaps, those vulnerabilities, or those things that we saw during the exercise. What we chose to do was organize the TIP into 5 categories just to kind of keep things straight, to help us just what it says, avoid duplication of effort and maximize. Again, it's back to sort of identifying what we need. And so we sort of grouped everything that came back to us into these 5 categories. And then, and we're still in the process of finishing up this piece of it, put them onto a task list, and then start assigning completion time frames for when you want to fill that gap. And some of them we already have. You know, we ran into equipment issues out there. One of the pieces of equipment didn't work, and we set up a regular testing schedule so that we wouldn't show up and find out that it didn't work again. Some of these things are like the projects in our natural hazard mitigation plan. They're just things we're not going to be able to achieve until we find the funding for them. But we capture that we need them in this documentation in the meantime.
Let me just ask you something, because the repeater system is paid for, maintained by volunteers. Do you include that when you're looking at the scope of what's needed?
Well, the private repeater system is run by volunteers. There are a number of repeater systems in the county. I do not look at the private. We look at all of the systems in terms of gaps and vulnerabilities, but that's what the exercise provides. We don't know what those are unless people are exercising and we see that happen.
It's just very complex. I'm just trying to get a picture of what's there, and somehow I have
Yeah.
confidence you're taking it all into account.
Pardon?
Somehow I have confidence you're taking it all into account.
Yeah. Well, it also has to do with how well those private clubs are communicating with the Oxcom group at the EOC, and I know that there's some overlap there, but those are, that's all part of the same network, and those are the conversations that occur there, when they meet on Saturday mornings and share information about the networks and how they interface with one another.
Thank you.
So, in conclusion, how did it go? It went great. It went awful. It was a mess. It was the greatest thing we've ever done. Were we prepared? In some ways, we were. We saw the things that we knew were going to happen. We knew we didn't have enough trained people. We knew that the few people that we did have trained were going to be spread really thin at the Emergency Operations Center, and they were. What ended up happening with that was that we had untrained people that we thought might have an opportunity to kind of try things out, but because there were so few people to run the operations, we didn't really have that training opportunity that we'd hoped for. But it's all good. It's the great thing about exercises. Mistakes are a good thing. It's a hard thing for people to get their head around, but coming away and identifying, that list of 40 or 60 things that people said after the exercise, this could have been done better. That's how we begin to improve. So. My great appreciation to everybody who did participate. It was a lot of work. It was a big commitment, and a real commitment on behalf of the citizens of the community for the people who chose to participate.
Thank you so much.
And I think that's all I have.
For an excellent presentation. And, in the time that I've been paying attention to this, maybe 10 years, we've come a long ways. And it's little things, and they all kind of add up to safety, and we're going to help our community. Walking along the Riverwalk just the other day, I was looking at the way we positioned the signs, not on a north-south, but on and I took a look at that, and it was just it was great. It was just a great thing. And so I compliment you and everyone involved.
I want to wrap up. I want to be respectful of everybody's time, but you bring that up, and I'm a cheerleader for whole community planning. It's what they encourage us to do. It's the importance of getting everybody's input when we make decisions, and those signs are a beautiful example of that. Those are signs that are elsewhere on the coast, and they're just a snapshot of the inundation maps. And we got a grant to put them in. And while I was working with the Arch Cape community one day, trying to figure out how to work that out, I said, okay, well, which way do they face? And they said, well, it should face you each way. It should face you as you're going on the beach, and it should face you as you're coming off the beach. We got into this conversation about now if you're on the coast, it's easier to figure out where north is, but how do you orient yourself? And we started talking about being in that state, that cognitive state of panic, and how well does your head work? And how well do you know which way north is when your head's working well? And we decided to orient the signs to the viewers. It was unorthodox, and people that were working on the project, specifically a pilot, a GIS planner, and a city planner, said, well, you can't do that. Maps are north oriented. And we said, well, then we won't call them maps any longer. We'll call them signs to save lives. And that's what we did. So I just met with Manzanita. They're putting in "You Are Here" signs. The man next to me at the meeting said, we're orienting them to the viewer. I said, we did that. He said, thank you for setting that in motion. It wasn't me. It truly was a whole community planning at work. That wasn't something that I necessarily would have thought of on my own. But once one person did, a number of them thought it was a good idea. So anyway.
Again, thank you. And
I just had a question, Tiffany, forgive
Sure.
me, so you are the go-to person for all of this information, is that correct? For the county?
Yes.
For the county, okay, because I was looking on the website, and I didn't see your name under emergency planning.
Well, I'll check that out.
Okay, so if someone has, if some community organization wants to get involved, they'll want to talk to Tiffany Brown.
For now, I'm the only person here, but yes,
So
they can.
how big is your department?
Our department is a staff of 3, but we have two vacant position. We have 1 vacant position now. We're filling those right now. So
When you did this exercise, it was last year, how many did you have in your department?
we had 3, 2 part-time coordinators and myself.
Okay, so you hope to be able to get that back up and running?
And we will. It's going to be configured a little different. I don't know if you remember, but we kind of rearranged our FTE this year, so we'll have more of a full-time person.
But are you getting what you need?
Yes, yeah. In fact, we just hired, we just offered somebody a position yesterday.
Oh, well,
So I
congratulations.
hope we'll be telling you about that sometime
Okay.
soon.
Okay, well, thank you, Tiffany.
One
Appreciate it.
more question. This TIP sounds very interesting to me. Will we be updated? Is that part of our plan?
Yes.
Will we be updated
You know, and
on
in
that?
fact, what I wanted to say to you is that an after-action review is for official use only document. And the reasons for that are because I think there's such a propensity for people who don't understand the exercise environment to see them as a report card or a comparison. And that really works against what they're trying to do. People make themselves vulnerable by being willing to be in an exercise and make mistakes. And so for that reason, that's why we didn't put it in the packet. That's why we didn't. That said, any of you are free to come by and look at the after-action review, look at any pieces of this that went into it. I'm happy to share that with you. It is interesting, and I think it's good information for you to have.
Very interested in that. And I would like to see us each with a one sheet that says what county staff do, what do we do in case of emergency? Because I know my brain doesn't function well when I'm terrified.
Yeah.
And I would find that enormously helpful.
And I think also that there was a interview on the radio after the tornado down in Manzanita, that the preparedness in that community really shined during that time period because people had practiced and people had communicated and they were able to really help that community a lot after that.
That's an amazing program there. Yeah. Thank you so much.
You're welcome. Good report.
Okay, our next presentation today is the Public Health Triennial Review.
Good evening. I'm Dana Drum. I'm the Strategic Partnerships Lead at the Oregon Health Authority Public Health Division. So I am here and I actually have some handouts. So I'm guessing some of you have been through the Public Health Triennial Review before. And what we like to do is after the review and after we provided all the findings and information, we share it with the Public Health Administrator and also with the Board of Commissioners in your role as the Board of Health. And ultimately, our contract is with you. We have a financial assistance agreement that provides funding for public health services. We recognize it's not, we would love to, I'll just say we would love to provide more funding. It's a pretty limited pool. Most of our dollars are federal dollars and a little bit of state general fund and some other funds. So anyway, Mike, is there anything you want to say before I get going here? Okay, all right. So the triennial review, it's based on the contract that we have with you to deliver public health services. And every 3 years, we do a review of all health departments in Oregon. And people ask me why every 3 years. And I just think at some point someone did the math and there were 36 counties. We have 34 health departments now, but I think at the time there were 36. And you can do one a month over the course of 3 years. So that's, I think that's the magic of why it's a triennial review. But we did conduct a review in December and part of January with CLATSA Public Health. The weather wasn't our friend this winter, and so it was a little extended. But we really approach it in a partnership perspective. And it's an opportunity to identify strengths and also identify areas for improvement. And while we're, want to identify anything that would indicate noncompliance with federal, state laws or funding requirements, we really want to identify those, provide any necessary technical assistance so the department is successful. So we really do try to approach it in that vein. And so given that, I wanted to share with you some of the areas of strength that we and my other public health division colleagues found. We recognize that you are a strong, supportive board when it comes to public health. I know, I believe in this just started new fiscal year, you've provided or approved some additional FTE for environmental health, and I think you'll see that will make a difference with some of the areas for improvement we identified. The department, especially through the director, Mike McNichol, has extensive community involvement, a lot of strong connections also internally across public health. So the folks that do environmental health work closely with the folks that are investigating communicable disease issues. And as one example, there is good collaboration between public health and emergency management. In some communities, that goes better than others, and I think you guys have a strong relationship there. There's been significant immunization outreach within the community, partnering with early childhood programs, doing flu clinics to get annual flu vaccine to populations that are difficult to reach. Some creative staffing models in family planning and reproductive health. There had been, I think there was a gap for a period of time in a provider, and a lot of work was done to utilize temporary and part-time folks to be able to fill that gap, and now there's a naturopathic physician providing those services. The staff are incredibly dedicated and experienced in the work that they do, and over, the individual program staff noted that in their review comments. A lot of work's been done around prevention with tobacco-free properties, collaborations around cessation with the coordinated care organizations and other regional partners, and then also vital records, really timely and prompt service. I think the turnaround time is 1 day or something like that. So, overall, I just want to say this was a good review, and you should feel good about the services that are being provided to the citizens of this county. So in terms of areas for improvement, I'll just kind of walk through those. The immunization program has we have a requirement that local health departments will be monitoring the uptake of the first dose of hepatitis B vaccine when a baby is born. We like them to leave the hospital with that first dose. And when that drops below 80%, we want the health department to do a concerted effort to work with the providers to try to get that uptake higher. And so we asked them to submit an action plan. They did, and that's been resolved. That finding's been resolved.
Mr. Chair, if I may. So does every child need this immunization, or only babies who are identified as having hepatitis B?
I am not an immunization expert. I think we want Every child, okay, good, thank you. Every child to receive the hepatitis V vaccine, so not just the ones that are identified. And at the very least, we want parents to be informed of the need for the vaccine before they leave the hospital, but ideally, we want that first dose given.
And what we found when we went to and talked to Seaside is that the people who are tracking this, it's really a data management issue is what it came down to. And when we actually had to go, it wasn't the providers, it was the data tracking. So we actually spent some time making sure that that was being tracked better. So, and they have a lot of turnover in their data entry folks. So it's our process now is to make sure that whoever's in that place is making sure that's being tracked appropriately. Because it's not like we were missing that. We were getting to the level. It just wasn't being recorded appropriately.
Okay, thank you.
Sorry.
So yeah, that's sometimes, well, the saying, if it's not documented, it didn't happen, and so that was the issue there. There were just a couple. There were a couple of policies, fiscal policies, that just needed to be updated to reflect the current agreement with OCHIN, which is your electronic health record provider and part of how you bill. And so that's been resolved. The food pool, lodging, health and safety. So as you are aware, restaurants, tourist accommodations all need to be licensed and they need to be inspected. And the inspection rate was below 100%. We kind of 95% is kind of the benchmark. And I think part of that is that one of your environmental health folks changed jobs, and so we're really pleased to hear that you are adding some FTE there, because when we looked at the number of inspections that needed to be done in relationship to the capacity that you had, it was just, just wasn't a way for that to get done. So that's not considered resolved yet, mainly because we look at the data after a period of time to see if those inspection rates are back up, and if they are, then we consider it resolved, and you'll get a letter from us letting us know. But I believe that's the only remaining open finding that we had. And I would expect that by the time we look at that data, we'll see that those numbers are rising. And then again, just some documentation issues as well. I think we found that it was clear that the work was being done, but it just wasn't getting documented, and that's probably a workload issue. And so that's since been resolved. In terms of drinking water, making sure when this compliance finding gets written, or area for improvement, it sounds like you're not investigating water quality alerts. You are investigating water quality alerts, but we weren't always getting the documentation, and so that's since been resolved. And again, my hunch is that that's a workload issue. So, and then similarly, if a water system has a significant deficiency, then there has to be a follow-up. And if it's not corrected, then we've got to make sure that there's a corrective action plan that's been submitted to the state for that. So all of that's been resolved. Within WIC, that's the program that provides supplemental nutrition for pregnant women and children. There were some policy issues in making sure that the training supervisor, there has to be a training supervisor designated in the WIC program, making sure that person meets the qualifications, making sure that the letters about ineligibility and when folks graduate from the program and they're no longer eligible, those go out on certain timelines. And then making sure that there's documentation that's been signed when there's certain types of referrals. And then making sure that there's also documentation that happens in the care plan, and all of that's since been resolved. Emergency preparedness, which is health security preparedness and response, wanting to make sure that staff that are going to be expected to play a role in an emergency situation, be part of the incident command system, that they've been trained in those roles, and that training is consistent with local plans and national standards, and similarly, those that are going to be assigned a leadership role, making sure that they have completed the necessary training. So again, everything is, except for the inspection rate area, is considered resolved. It was resolved fairly quickly, and so we don't really have any concerns at this time. And then you'll receive a letter from us once we look at those inspection rates again, kind of officially notifying you that everything's been closed out. So with that, I'm going to just stop right there and see if there are any questions about the triennial review, what I've shared so far.
If I may, do you have any recommendations about staffing levels? I heard workload issues interfering with documentation that's required, and I don't know if you have worked with the department director on this issue. My hunch is that you have.
Yeah. So Mike, I want to give you an opportunity to respond to that.
So what we did is we met with the food, pool, and lodging folks, and there's some guidance from the FDA as well as from the National Environmental Health Association about the number of facilities versus the number of people that you should have. And we were about 50% behind where we should have been in staff. So actually, this finding is something that's been occurring for 10 years in a row. So this is not new. So I wanted to address it now. This is my first time to actually get to address it. So we wanted to make sure we get to 95%. 100% is the goal, 95% is the benchmark. So the only way to do that is increase our FTE, and that's what we did with the help of Cameron and the budget team, and so we made sure we got there. So we have until the end of December to prove our numbers. We're going to be there. We've made a real strong effort to get there. So in the drinking water program, similar thing, we were down. We didn't have enough people. We were just stretched too thin. So now we're going to have the people in place. And
Right. It's important not to stretch people too thin.
yeah, and then I changed roles in September last year, and that kind of put everything else in. So now we have people in place to make sure we get the actual field work done. For our temporary hire, we hired Yvonne Van Nostrom, who comes with us with 20 plus years of experience. Fantastic, she's in the crowd. So, and so we really want to make sure that we hire the right people to help us get out of the hole we found ourselves in after a decade. So.
Thank you.
And to give you an idea, the FDA recommends that that you have 1 FTE for every 250 to 300 inspections, and you had 1.1 FTE doing approximately 700 inspections. So that would explain the gap. So it sounds like we're well on our way to get that fixed. So. The other thing I want to mention is that the Title X program, which is a reproductive health program, is a highly regulated program, and I think it's commendable, and I just want to note that there were no compliance findings for that program in your department, and that I think speaks to the expertise and capacity of your staff, because it doesn't happen often that there are no reproductive health compliance findings. It's an incredibly complicated program, so that's a federal program.
Good to know.
Yeah. So I want to shift a little bit and talk some about where public health's going into the future. I think Mike has talked some with you about public health modernization. We've spent a lot of time since 2013 working with a variety of stakeholders in an effort to identify what are the core public health services that every person in Oregon should be able to have access to for their health, public health, and for safety, and how do we move towards sustainable funding for that? I mentioned to you, mostly of what we provide are mostly federal funds. We recognize it's not enough. And we have some counties where there's no general fund provided whatsoever. And I know that this board does support public health, and you should be commended in that. But really, we've been in a time with health system transformation. More people have insurance coverage, at least for the time being. And if folks are getting more of their clinical services in the primary care home, then, what is the role of public health? Because I think public health's often been thought of as the safety net clinic in some communities. And while there's always going to be a need for that, for at least some of the population, that moving forward in the future, may not be the case. In some communities, there may be enough access that public health doesn't need to be providing clinical services. In other communities where there are access issues, that it will be important for them to continue to do that. But what has often happened has been those clinical services have helped to fund or enable a health department to have the capacity to respond to disease outbreaks, to respond in emergencies. There is very little funding that comes from the state for communicable disease investigation, and I don't think primary care providers or coordinated care organizations are going to want to be the ones to do tuberculosis investigations and making sure that folks are getting their medicine every day and all of that kind of stuff. And that is a core public health function, as one example. And so in 2013, the legislature called for a task force to look at the future of public health services, and they recommended a framework, which we call the Foundational Capabilities and Programs. It's represented by the wheel on page 6 that outlines communicable disease, health promotion and prevention, environmental health, and then access to clinical health services. And then there are a number of capacities, competencies, capabilities that help support that work, and those are outlined on the outside of the wheel. But so in 2015, that framework was adopted into Oregon Revised Statute, and then there was an assessment required. And so your health department, along with 33 other health departments and the state public health division, assess their capacity and expertise with where they are now, with what it would look like if they had those programs and capabilities fully implemented. And what we identified across the state was that there were $105 million was needed to close the gap annually.
Pardon me, do we have access to the copy of that for Clatsop County? I think, Mr. Chair, I think it would be good for us to see that as the Public Health Board.
Yeah, is that available?
Yes, I mean, the health department, yes, Mike has it, and so he can.
Good information to have, I think.
Yeah. So, and if you have questions or want me to come and talk through that more with you, I'm happy to do that. Just to give you kind of a sneak peek, what we found across the system was that there are a lot of gaps, but there aren't a lot of consistent gaps across the whole system. We know that there's some gaps in communicable disease. I think about a fifth to a quarter of Oregonians live in a community that really struggles to respond to a communicable disease outbreak. We know that health equity, that was the one area that consistently across the system, we need to build capacity. But the rest, it's kind of a patchwork. It looks different. One area that we're pretty strong in are the inspection pieces for environmental health. And I think part of that is that's a fee-driven program. So you're able to have the capacity to do that work. Ultimately, we want every Oregonian or every person in Oregon to have access to those core services for basic public health and safety. And our goal is that there are a variety of sustainable funding sources to help support that, and that this public health system is accountable for that work. So the Public Health Advisory Board, the State Public Health Advisory Board, has just adopted some accountability metrics, and we'll be collecting baseline data on that over the next year. There's also a provision for some matching funds and incentive payments depending on how health departments do on those accountability metrics. We are in the very beginning stages to kind of, what does that look like and how do we, contractually do that? We don't have funding for incentives at this moment, but we will be starting to collect the baseline data over this next fiscal year. We'll also start to collect actual revenue and actual expenditure data for public health departments. because that'll help us get a better picture of what are some of the local investments, what are some of the other funding streams that local health departments are utilizing to provide the services. And that will also become the basis for, when it comes time to look at incentivizing matching funds. So. I'll just call your attention to, on page 9, there at the top slide, we call it a patchwork quilt. Each column represents a local health department, and in Oregon, we've kind of stratified them by size. But that's what I mean when it's really a patchwork. Dark blue shows that health department in that particular area, program area, is really significantly implemented. And then the light orange or the dark orange actually shows that it's minimally implemented. And so you kind of see how across the system.
I need a little more help with this. Can you?
So down the left, the words down the left, and this is where we can, if you want to look at your assessment, Mike can kind of walk you through this. The P's represent the 4 foundational programs. So for example, the first line is the communicable disease program area. And then the C's represent the capabilities. So CAEP is assessment and epidemiology. So, and then as you go across, each block represents a single health department and how they assess themselves in that particular area.
So the size extra large to extra small, what does that refer to?
Population size.
So where do we stand in this?
Yeah, that would be my guess.
Close to extra small.
Close
Correct
to.
in the middle on most things, so
Okay.
kind of in the middle. Yeah.
Well, no, he's, yeah, good.
Because there's two measures, it's, are you, not only are you capable, but, what's your current ability to, it's kind of a long, complicated thing.
Yeah.
I don't know how many months took us to do that.
Well, it actually was only done, I think, in about 6 weeks, which was crazy. But it took me years. Yeah, we had a very quick legislative turnaround on this. We had to, but it did feel like forever, yes.
But these data will help us plan. Cool.
So there is a little bit of new money. There's about $5 million that the legislature allocated in this session for the biennium. And likely what will happen is there'll be some sort of we'll probably be funding some pilots with a focus on really encouraging some cross-jurisdictional collaboration across counties or across regions.
So did I hear you say that the $5 million was from House Bill 2310?
Yes, I didn't say that, but you're right. It wasn't actually connected to House Bill 2310. It was actually allocated in the budget, was how it fell out. But House Bill 2310, originally, I think it was connected to that.
Okay.
So, but the focus will be on communicable disease control, health equity and cultural responsiveness, and assessment and epidemiology. The assessment and epidemiology is really focused around data systems, most of which we house and are quite antiquated. And so, this will be a little bit of money to help begin the process of updating that. One of the things we hear from our local partners is that our data systems, our electronic systems are kind of onerous and not user-friendly, and we recognize that too. It's, as you can imagine, within state government, it's difficult to improve those systems, so it takes time.
And expensive.
And it's expensive. So you mentioned House Bill 2310. It was just passed unanimously by the House and the Senate. We're waiting on the governor's signature. While I can't speak for her, we expect that she will be signing it. And we really saw it as the legislature being supportive of the direction all of this work is going. We recognize that it is a difficult, it was a difficult budget year in the legislature. I did mention the $5 million. Approximately 3/4 of that will go to local health departments. But in the conversations with the Public Health Advisory Board and the Conference of Local Health Officials, I think we all agree that if we give everyone $5, we can't really tell the legislature that we've made a lot of progress, which is why I think there will be a focus on pilot projects so that we can maybe test some concepts and demonstrate some progress over the course of the biennium to help support, being able to make the case that yes, we're moving in the right direction, and when there's the opportunity for more investment, that would be a wise place to invest.
Well, just looking visually, back to your graphic again.
Yes.
It appears that limited implementation and minimal implementation are concentrated in the part of the pie where we're located. So somewhat selfishly, I hope that we'll be eligible for some of that money.
Yeah, we have, a request for proposals hasn't been released yet. I think the goal, though, is that we craft something, part of our experience has been is that counties that have a lot of capacity tend to have a lot of capacity to even apply for competitive funding. And so we're working really hard to figure out how do we stay true to state contracting rules and yet create a process that doesn't create more dark orange and light orange blocks on this map. So this is something we're really aware of and trying to sort of navigate our way through that.
Balance again to get equity.
Yes.
Equity,
Yeah. Because equity really is at the center, and we see more and more of the smaller health departments really kind of looking at how they are going to deliver public health services in the future. And our hope is that through incentivizing some sharing of regional expertise, as well as having the opportunity to be innovative, will help spur some opportunities moving forward for how public health might look, and we can be in a more proactive mode as opposed to a reactive mode.
Sounds very good.
So with that, I think I've kind of touched on everything. The only other thing I should mention is we are in the process of updating the administrative rules. We've not done that since since prior to the changes in statute in 2015. So we are, yesterday we actually started that process with the Rules Advisory Committee actually starting to meet in mid-August for that work. So there's a lot of work happening.
Great. I really thank you today for the report. It's been very informative.
Great.
Do any of the commissioners have any comments or questions?
Equity is a good word.
Yes, it is.
Yeah, I think just kudos to Mike and his team. This is a really good review, and I know it's a team effort, so appreciate it very much.
Absolutely. And I think especially given the transition that you've been through in the last year, I mean, this is a really positive review. So thank you.
Good work.
Okay. This is an opportunity for anyone to give a 3-minute presentation about any item on the agenda. Is there anyone here tonight for public comment? Seeing no public comment, I'll move on to looking for a motion to approve the consent calendar.
So move. Second.
We have a motion and a second to approve the consent calendar. All those in favor? Aye.
Aye.
Opposed? Motion carries unanimously. And we're going to now move on to the business agenda. Our first item is the professional services agreement for Bugle Road Design, page 93. Michael Summers, come on up.
Good evening, Commission. Michael Summers, Clatsop County Public Works Director. Before you this evening is to consider entering into a professional services agreement with KPFF Inc., which is a transportation civil engineering firm out of the Portland area. It is to, as part of the 17-18 fiscal year, we've outlined the construction of a roadway in the Northwest Business Park. This roadway would be in the center of Ensign Lane between 19th and alternate 101. There's a big driveway. We want to extend that road to the south from that curb cut to the south, and this is the contract to have the professional engineering company design that section of roadway. It's about 650 feet long. And this work is also it includes roadway water line and water domestic main construction and street lighting, sidewalks, storm drainage, wetland mitigation, grading, all that, pavement and curbs and stuff. We're recommending a sole source contract for this one. They're working in the vicinity. This same company has also worked on the sheriff's office. They're the civil engineers for the sheriff's office remodel. They're familiar with the area. The state law, ORS 279, allows for professional services to be direct hire up to $100,000, while the local contract review board rules for Clatsop County have an allowance up to $10,000, but we can make some recommendation that we contract with them for the amount of $68,085. It's budgeted out of the Industrial Revolving Fund, which funds infrastructure in the North Coast Business Park. I'm here to answer any questions.
Great. Any questions for staff?
Yeah, I do. Thank you. I was driving out there yesterday to try to find out where this was at, because it's hard on the diagram that you showed. It's hard for me to figure out where this was.
So if you're familiar with the Costco gas station and the Astoria Ford dealership,
Yeah,
you go from that intersection, 19th and Ensign Lane, to easterly towards Miles Crossing. And then you, halfway between 19th and kind of by the food bank, which is on the south side of Ensign Lane,
right.
there's a big driveway, curb cut, there's there's a acceleration lane, the road widens in that section. And then it's on the south side of that intersection that's to be built. It's extending this roadway to the south.
So what is this intersection going to go to?
It's going to extend all the way to 19th Street to the south, and it'll provide another transportation connection. It'll go between the animal shelter and the sheriff's office, kind of in front of the OIA, adjacent to the Oregon Youth Authority facility off 19th.
Because that needs to be improved because of the jail that's coming in, or what is that? I mean,
That's a
when I
separate
drove out there,
project.
one way is the sheriff's department, right? And then it goes up to the animal shelter, and
Food
the other
bank,
way is
senior
just
center.
sticks. I mean, not sticks, but just brush.
Correct. The next plan after, should this roadway be constructed, is to extend it to the north, and that'll open up further development of the lands in the North Coast Business Park for future development.
So, I mean, is this planned for development that you know is going out there, or?
It is adjacent to the Fort George property, the big beams. The county sold the land adjacent to this roadway directly north of the sheriff's office about 2 years ago
Right.
to the parent company of Fort George Brewery. And this roadway is adjacent to their piece of land.
So it's going to improve the capacity for their new development up there?
It will
Correct.
actually facilitate their development, and then it will also open up another piece of land that we'll own on the other side of the street that the county has that will be now more likely, more attractive for development.
So when we do that, does the project that is getting developed, do they share in some of this cost?
No, this is actually funded by this roadway only is funded by the county, but the county has, and working with the Business Oregon group of the state of Oregon and the Oregon Department of Transportation, is pursuing a grant to fund a lot of the construction effort for this roadway. So I'll help offset the actual construction costs.
But you see what I'm saying? I mean, if it was just an individual, you know, if they wanted to do something, they would have to pay for part of that, right?
Well,
That's not the way the current business park is set up,
Right.
so.
I'm just asking. I'm trying to learn as much as I can. I mean, that industrial park has been out there for a long time. So
Correct.
because we now know that and to prepare for this new development, this road is increasing the capacity for that new development.
It'll provide them an avenue to develop, as well as open up another parcel of land for the county to sell and develop it as well.
And then that you're going outside of even though the state law says you can hire without asking for more offers, You're doing this because this company is already working out there? That's correct?
They are already working out there, and they've worked in the vicinity.
Are there any local companies that do this kind of work?
There's one in Gearhart, and that might have the capacity, and there's one in, there's another one actually in Gearhart that's a little bit smaller of a firm that I think they're under capacity to do a project of this magnitude based on my knowledge of them.
So your decision to not ask local companies to do this was based on that you were familiar with this company already, or?
Is partially because of the experience I've had working with them on the sheriff's office remodel, and that they're a part of an existing development team for the project next door, which will lend itself to have some efficiencies with the coordination of the design of the roadway and the design of the neighboring development. It lends itself to be designed a little more efficiently, which would yield some economy of scale.
Well, are you able to get any kind of bonuses that you would be, since they're already out there, they don't have to move all their equipment out there? Is there any kind of discounts that we can get if we go with these guys? Since they're already-
This is a design company, so.
This is just a design company?
This is just the design of it.
Oh, this
So
is
it
just a
wouldn't-
design company.
It wouldn't be the
Construction.
construction would be a separate, we will bid it out, the construction.
So then we're
with the-
talking about a great deal more money than this.
Of course.
The
Roads
the
are
estimated.
very expensive.
Oh, I know.
Yeah, the total project is
I'm
going to be, I
learning.
think, close to $1.2 million.
Wow.
Correct.
Wow.
And again, we've got roughly half of that, about $550,000 in a grant from the state.
So I was curious
Thank you,
about
Michael.
this. And I called Michael to talk about this. And so we talked about, I likened it to being on horseback and having taught enough reins. So this firm is good at quality assurance and making sure that we not only spend the money wisely. Is that that's just
But
the
also
quickest way
hold
to say it.
the third phase of this contract is construction engineering services or construction administration services. And what that does is hold the contractor who constructs the roadway accountable during the construction process, which is the standard phase during the engineering, design, bid, and construction process, is to have the engineer of record have oversight over the actual contractor building the project. So this firm is excellent in doing that aspect of the work.
So they have to stand by their design.
Correct.
Okay, if there's no more further questions, I'll look for a motion.
Yes, Chair Lee, I move to approve the professional services agreement with KPFF, Inc. in the amount of $68,085 for Bugle Road final design services and authorize the county manager to sign the agreement and any amendments.
Second.
We have a motion and a second to approve the professional services agreement with KPFF Incorporated in the amount of $68,085 for Bugle Road final design services and authorize the county manager to sign the agreement and any amendments. Seeing no further deliberations, all those in favor? Aye.
Aye.
Opposed? Motion carries unanimously. Our next item tonight is a notice of sale of mineral rights to a surface owner and set hearing date, page 125. Good evening, Serpa.
Good evening, Chair Lee and members of the board. I am here to ask you to set a hearing date and approve a notice on a request for the surface owner to purchase the mineral rights that the county retained in 1961. It was a practice in those days often to retain mineral rights. And this property currently belongs to the heirs of Catherine and Glenn Bard, and they are in the process of selling, and the purchaser would like a clear title without any clouds, and so they would like to purchase the mineral rights. The process is consistent with our property management policy and Oregon revised statutes. And the statutes set the procedure for this by asking to have a public hearing and get a geotechnical report, and then do a notice in the newspaper once a week for 4 weeks. And I am here to ask you to do that tonight. Interestingly enough, I just received the geotechnical report on this small parcel in Seaside, and the conclusion is that there is no mineral resource value under the present or reasonable future conditions, so this is just a formality.
Yeah, I understand that. I went through this on some property up in Washington State about 25 years ago. Fairly straightforward, so.
Yeah.
You have a question?
So, Serpa, you said that, that in 1961, when this was originally sold, the counties would hold on to the mineral. They're not doing that anymore? Is that a change in just fashion of how people sell land, or?
Yes, and I think in the 60s and 70s, there were some gases and other minerals, and so they decided to, retain those rights, but.
And obviously, in this piece of land, it doesn't matter, it's just a technicality.
Yes.
Do you know if the properties around that, do they hold their own mineral rights, or is that something that's changing?
Most people don't
I
even
don't
know that
know.
they have mineral rights or that other people own them, particularly for rural property. It's very rare that we go through this process on an urban lot. But, yeah, it's actually, there's real, if you wanted to study it, it's a very interesting thing. A lot of people don't realize that they don't own the mineral rights to their land.
And they used to be taxed if someone else owned the mineral rights separate. They used to be taxed, but in 1997, the legislature did away with that. So
I know the home that I grew up in, that we did not have the mineral rights. When they sold the house, they didn't have, they wouldn't sell us the mineral rights. So that's always kind of stuck in my head.
Right on.
Thank
Okay,
you.
Look for a motion?
Yeah. I move that the board approve the notice of public hearing and set the date for the public hearing for August 23rd, 2017.
Second.
We have a motion and a second that the board approves the notice of public hearing and set the date for the public hearing for August 23rd, 2017. All those in favor?
Aye.
Aye.
Opposed? Motion carries unanimously.
Thank you.
Thank you.
Okay, we're going to move on to the item C, the authorization of IGA with the Oregon Youth Authority for the Juvenile Department, 131.
Good evening, Chair and Commissioners. The item before the board is the authorization for the county manager to sign the 2017-2019 IGA with the Oregon Youth Authority for what are referred to as basic and diversion services. If you're interested in any history, this is traditionally, I started working for the county in 1988, and this was called downsizing money back in those days, and it has basically been the state's program to try to decrease the number of youth that get committed to state custody by providing all of the counties in the state money to provide local resources,
Right.
services.
Do any of the commissioners have any questions for staff?
Yes.
Go ahead.
Can you help me with understanding, since the OYA is closing, how does this work? Because when I looked through this, most of my questions were what happened. Is it not connected or not?
The OYA facility has nothing to do with this. The Oregon Youth Authority is...
Oh, okay, through the agency of the state.
The Oregon Youth Authority runs the youth correctional facility in Warrenton, and it is closing, but that's a completely separate...
So this contract is just through the OYA of the statewide thing?
Right.
It's not a
Correct.
facility?
Has nothing to do with the local facility.
It's state pass-through biennial.
Right. Yep.
Happens every couple of years.
Yep.
Okay, that helps me a lot, thank
There's not a
you.
lot of wiggle room here unless you want to go
Okay.
down to Salem,
No.
Unless you don't want the money.
which I would like a little more, bigger sack of money.
So I did
Please.
have a question. So Commissioner Nebaker, you've been talking about ACEs repeatedly, and I hear what you're saying. Nothing like that appears specifically in the, I mean, this is just a dandy contract. It really, as an old delinquency services worker, I thought, hot doggies, this is the good stuff. We can really make a difference in the lives of these youths and their Well, you know, might as well try,
can
right?
try.
Might as well try. So is there anything specifically, because you've got a bunch of really fine program elements here, and you've got good specific data gathering requirements, you've got a comprehensive spectrum of services. There's nothing that points specifically to what Commissioner Nebaker's been talking about, which is those ACEs scores. Is there any correlation with these activities and this new research?
I guess what I could say is ACES or trauma-informed care permeates
Right.
every service delivery system in the state. I mean, I think there was even legislation passed this session requiring more training and across all spectrums. So ACES has been around in the juvenile justice system. It's one of the topics at Juvenile Directors Conference this fall.
So it permeates. I mean,
It does.
that's clear. Well, looking at the policy statement, this is good stuff. Are we going to get reports on this? Will we be updated on the results that you're seeing during the course of this contract? Because I'd be interested in hearing what's going on.
There really aren't reports. I can tell you that as you can tell, there's actually a third pot of money which you approved in the consent calendar, which is called individualized services. They all come kind of different ways, but all three of those are from the Oregon Youth Authority. And so there's some ways that each of those groups of monies can be spent, and it's kind of really individualized. It's up to counties to work out plans that they submit to OYA. These plans aren't submitted until, I believe, the end of August, most of the time because counties don't know how much money they're going to get until
The legislature's done.
So those plans are submitted and reviewed, and I don't know that they're ever not approved by the state. And then basically what happens through that biennium, although the plan can be modified and updated depending upon what might happen during those 2-year period of time. So we submit requests to the state for service billing for those different time periods, but other than that, there aren't really reports that are generated, if that's...
I'm just looking for update. I mean, these are the most at-risk youth in our community, right?
Well, certain parts of this money are supposed to be used for the most at-risk kids in your community, yeah.
Yeah, I mean, I'd just be interested in some kind of additional information as we proceed through the year on what your activities are, what your results, anything that you can share with us that
I
would
can
help
certainly
us.
tell you what we're doing, and
Love to hear it. Love to hear it. Really important work.
Seeing no further comments, I'll look for a motion.
Chair Lee, I move to approve the 2017-2019 intergovernmental agreement with the Oregon Youth Authority for basic and diversion funding.
Second.
We have a motion and second to approve the 2017-19 intergovernmental agreement with the Oregon Youth Authority for basic and diversion funding. Seeing no further deliberations, all those in favor? Aye.
Aye.
Opposed? Motion carries unanimously. We're gonna
Thank
move
you.
on-
Thank
Thank
you.
you. We're going to move on to our final item tonight. It's the cost of living adjustment for unrepresented and management employees, page 167.
Yeah, and Mr. Chairman, I think I will take this. I think this is typically a task that falls to the county manager, but I was on vacation when the agenda was put together, so Robin had put together the memo based on my recommendation. I think as you're aware, all of our union contracts have, cost of living specified. You can see those actually listed in the agenda summary. So they range anywhere from 0 to 2.5%. The unrepresented folks, so typically every year there's a recommendation, it's what we're here for tonight, from the county manager about what type of cost of living adjustment we might do for unrepresented employees. And really, cost of living typically is tied to the CPI, the Consumer Price Index. I think if you look at the last 12 months of the CPI, it's been about 1.9%. So my recommendation this year would be that we do 2% for the unrepresented employees to be consistent with the cost of living index, Consumer Price Index, excuse me. And I'd be happy to answer any questions anybody has.
Any questions? Go
I have
ahead.
some questions, thanks.
Sure.
What's the difference between confidential, casual, and contracted employees? Counties unrepresented, which include confidential, I don't know what those different.
We have some employees that are unrepresented, that are in positions where they handle a lot of confidential information. That might be why they're unrepresented,
Okay.
as an example.
So of these, there's like 56 positions, and I know in the last budget, we have, vacation buyback, so when they're unrepresented, do they get medical insurance? Do they get the vacation buyback?
Well, they get basically the same benefits that everyone else gets. And some of the things, like you mentioned, the vacation buyback as an example, that is something that is unique to the district attorney's office and unique only to the deputy district attorney. So there's
That's only that department
like
that's good.
6 people.
Okay.
That participate in that. And the idea behind that actually is it ends up being a cost savings because people take less vacation. So we said, okay, let's try that. Let's see if we can generate some cost savings with that.
Of these 56 positions, how many are going to be eligible for the 4% of the annual salary incentive package?
I don't know the exact number. I would guess probably 40, maybe 45 of the 56.
Wow. So, I know this is a really tiny little thing, but it's 1.9%, but you went up to 2. I mean, you could have just, I don't know if that would, with that many, would that make, how much, wouldn't made that much difference to round it up? If we're basing it on the index?
Yeah, I thought 2% was, it's whatever, 1/10 of a percent, maybe higher than what the actual has been. I thought it was a good rounding number. Plus that 1.9%, I believe, is through May, and so my guess is that the last couple months we've seen the CPI continue at that level. So.
And we had to wait till, I guess I was confused when I saw this because I thought that this was already approved, but we had to wait for the Consumer Price Index numbers in order to do this? Is that that's why we're getting this now? It wasn't approved in the budget?
Well, we're doing it now because it's in this year's budget, and once the budget is approved, then I feel like I can come forward and make a recommendation based on the budget approval. I mean, we could try to do all those things together at the same time next year.
I don't know one way or the other. It's just so what it wasn't really a set number at that time. You're waiting for this and then do the set.
Well, in the budget that you approved, there is a 2.5% cost of living for unrepresented. That is basically what we did last year, was 2.5%. So we used that number in the budget. But when we looked at the actual Consumer Price Index information, it wasn't quite that high. That's why I'm recommending something a little bit lower.
Okay, thank you.
Yeah.
So now I have a question. Do you have a fiscal impact for the 40 employees if they all get that 40%? I mean, do we have a range of what we might be seeing?
I don't know. I know it's well under what we budgeted, but I don't know the exact dollar.
It's sort of an arcane question, but I was curious.
Okay, seeing no further questions or comments, I'll look for a motion.
I move to approve the attached resolution in order implementing a cost of living adjustment of 2% for Clatsop County unrepresented confidential and casual employees effective July 1st, 2017.
Second.
I have a motion and a second to approve the attached resolution order implementing a cost of living adjustment of 2% for Clatsop County unrepresented confidential casual employees effective July 1st, 2017. All those in favor? Aye.
Aye.
Opposed? Motion carries unanimously. Thank you. Thanks. We're now going to move on to commissioners' reports. Commissioner Nebeker.
I have nothing.
Commissioner
I
Clement.
have nothing.
I've got a couple items to move quickly here. Thank you. You're excused if you needed to go. Oh,
Don't we have an executive
I'm sorry.
session?
I got a little ahead of myself. Excuse me. Commissioner Nebeker had some time constraints tonight, so.
All right.
I have a few items. Okay, you may have seen a couple emails. I was in communication with Commissioner Sullivan about the Economic Summit, and then we have the Coastal Caucus occurring on the 26th. It's really important that one of us goes to the Coastal Caucus. I know that's a board day. There's no way we could do both. So
I'm going to that.
you're going to that. So I would move that. Thank you for that. And
I would also like to go, too.
Yeah.
okay, well that's fine. So then and then we'll still have a quorum so we can conduct regular business. I really appreciate you to go into the Coastal Caucus. It's really an important group. Senator Roblin does an excellent job. I've gone in the years past. Unfortunately, I can't go this year. But I'm really pleased to hear that the two of you will be going.
When is it?
It's the Wednesday, the 26th. It's the next.
Oh.
It's the day of the next meeting. It's kind of things got jammed up in there. I was surprised. It's okay, but really, again, thank you for attending that. I attended the legislative and the executive meeting of the Oregon Coastal Zone Management Association. I'm chair both, and this is the first year that we have. As I've been reporting over the year, that we've taken a policy stance, and we've had some great successes this year through the work of AOC and cooperation with the Oregon Coastal Zone Management Association. Our first bill that we had carried to the Senate Bill 867 was Commissioner Hunt worked really hard in the Oregon Coastal Zone Management Association group, and with Rob Beauvais' help and AOC, we passed our first bill that we introduced to the legislature, Senate Bill 867, which is the Maritime Workforce Development. Maritime's not really considered a state unemployment sector as much as it should be, so we got some money to develop workforce development in the maritime areas. This is a really good area for us here in the coastal counties, and so I'm very pleased to report that. We also have been monitoring a number of other bills, and I'll just go down quickly the ones that have passed. And a couple that we were unfortunate that we were going to try to reintroduce or see if we can get some, carry some more water to have them on the short session next year. We had House Bill 2784, study of health shellfish populations, ocean acidification and hypoxia, Senate Bill 1039 passed. The Oregon Coast Trail bill passed, so we're going to do some study work. We got some money to study the Oregon Coast Trail. There was an interesting article in the paper, I think it was the Historian, about, the Oregon Coast Trail is become popular as Pacific Crest Trail. Sorry, Oregon, you can't beat the PCT. A study on health of shellfish populations in Oregon passed. This is really great because we've had the calcification problems. We have all of the port IGAs, the intergovernmental agreements, port advertising. We have a new member as a liaison and a voting member of Oregon Coastal Zone Management Association. I was pleased to report that Commissioner Spence has taken an interest in the past. We haven't had representation from the port, and we have new representation on the port and new engagement with the Oregon Coastal Zone Management Association, and we were pleased to report that a number of port bills passed. Probably the most important to our area is House Bill 2902, which allows ports to manage their own shipyards. For instance, to be able to pull boats out of the water so we can have a port instead of a private contracting or a private enterprise. The port can take over running a shipyard. It's very important.
Do we have a plan for the Port of Astoria to be doing that, do you know?
Well, we don't, but hopefully the Port of Astoria does, or is in the works of one. I know there's been talk, I know Executive Director Knight, this is very, very important for us here as the closing of the AMCO shipyard. We need to get a, 100-foot minimum yard here, and this is just very important. And I know that the county will support this, and I'm pleased to see the port taking some leadership there. And the state is helping too. So things all may come together, and we'll have it's a safety issue. You get a ship that breaks down and needs to get into port immediately. We have to have that here. And then there's a transportation package, which is kind of statewide, so I don't want to go into that, but I was really pleased with the transportation package, and there were some trades-offs on the transportation package, and, for instance, pay attention, I've got a $15 bike tax I got to pay now, so the transportation package passed. It was good for the counties. There was a lot of horse trading going on, so all in all, it was an interesting session, and so that's the report there. Northwest Oregon Housing Authority. We had a meeting at Gable Park, which is the St. Helens. We move around to each county every few meetings. It were some highlights of the meeting. We had a long-ranging discussion about some of the projects here. We're going to build some new buildings in Tillamook and Columbia County. And we had a long conversation about the merger. And so I will be pretty much at the next meeting, we're going to get the final nod from this board, and then at the next NOAA meeting, we're going to have the papers drawn up for the merger, and in the following meeting in September, it looks like the merger will be complete, including the Clatsop Shores property, which NOAA is...
Really?
Really? It's only taken 6 years and a half, but I think we got it. And and really, yeah, I've seen is believing. So I think we got some product that we'll bring forward. I think that the NOAA board's ready to go. And NOAA board is willing to take over the Clatsop Shores and make those decisions. And in a lot of ways, NOAA has been doing this all along for the last 5 years anyways. And so there's been great levels of trust built between Clatsop, Columbia, and Tillamook County, and I've worked really hard on this, and I think I have the commissioners on board, I can say with confidence, so we're going to move forward with this.
Good. Well
So
done.
I'm pleased to report that.
Really well done.
Thank you, it was a really heavy lift, it took a long time.
Chairman Lee, may I ask the bills that you talked about, the passing, would it be possible, I don't know if you have time, but would it be possible for you to make a list of what the bill numbers were and why they're significant to the coast, like you just did, that we could get into the minutes? Because I think that's important, the work that was done to help pass those bills for the coast.
Yeah.
And if someone wants to look up, oh, that was Bill 867, and that affected the...
Maritime Workforce Development. Yeah, absolutely. I can forward, I usually do forward the packet of OC to...
There's such a long list, and for you to have pinpointed which ones are important to us, it would be nice to have that in one handy reference point.
Well, yeah, theoretically, according to the vision that we had when we started this policy initiative, that we wanted to bring these bills that were basically all of the county commissioners from each county agreed on, that are participants in Oregon Coastal Zone Management Association. And so
Just be nice to have a tidy summary, that's all.
I would like that too, instead of having to
Teresa.
I've always to tighten things up, and I'll do my best to put something together. I assume that the minutes, and I'll try to work on that.
You see what I'm saying?
I see exactly what you're saying, and yeah, and so basically you can look here and say, then you got to kind of figure out if it passed or not by going to the bill tracker.
It's just too
And
much.
it's just a kind of a circular thing. I'll see if I can find some way to streamline that. I have to say that the AOC, Mr. Beauvais and the crew at AOC have done just an outstanding job in working with the counties out here on the coast in helping launch this new version of the Management Association.
So just to make your life easier, I've forwarded to the board as part of Northwest Act, the transportation section of that. So when you do that summary, that might make it easier, because I just sent those emails out.
I think I saw that. I haven't gone through it
Yeah,
yet.
yeah, this afternoon.
If you, yet one thing, is like, as long as I've been doing this, it's just like, there's thousands of bills that throw in the hopper every year, and it's really impossible to, You know, I talk to legislatures and representatives, and it's just like even staff members are just overwhelmed, and the session's so fast, and it's just fast and furious. It's really overwhelming. It's a really hard job. Staff, like I was just giving a shout out, Mr. Bovee did an excellent job on this. So I'll try to put something together on
And
that.
I haven't had a chance to read the bill that you had forwarded to all us about the housing, but
Yeah.
I'll be interested in what your thoughts are on that, too.
So perhaps for next year, we could go back to what we were doing earlier with Senator Johnson and,
Yeah, it was, you mentioned that before, and I think that that's something we might want to talk to, I could talk to.
if they're willing,
Like Representative Boone's staff and.
see if they're willing to do that.
Senator Johnson's staff about that, 'cause I think that's valuable for us to have that connection.
Oh, and I would like, as we go along, if there is something that we can go down, like you did, I would like to have that opportunity in the future, too. I mean, I certainly wasn't ready this year, but
Oh, sure, yeah.
I'd
Well,
like to do that, too,
there's-
to advocate for the county.
Always use some advocacy in Salem. On that,
On that note, I am going to Salem this week. I'm going to the FTLC meeting, so I'll be going down Thursday, and then going there and then coming back. Next week is the Northwest Senior Disability Meeting. I went, since the last time I meet first Monday with other Classic Care Network. It's a group. It's been great. It's learning a lot, and people from CMH, from Providence, from memory care units, and we talk about senior issues. And it looks like the Warm Line is coming on board, so that's great. They're trying to work on ways to reduce isolation in the senior population, which I think is terrific. The conference is going on in Portland at the end of this month that Commissioner Thompson is also probably going to attend. I'm trying to figure out how, with my work schedule, and also I want to go down to Salem again to the Board of Forestry, and then also do the caucus. I haven't figured it all out yet, but I hope I can get some of that stuff in. And other than that, I can't think of anything else to report, so thank you, everyone.
There were CERT activities over the 4th of July. There was, in fact, also a beach walk with Coast Watch to celebrate the signing of the beach bill, Governor McCall and all that. We county commissioners met with the judges, and were told that the brothers who survived the horrific abuse in Seaside were going to be adopted yesterday, and it was my intention to bring them presents. Well, I brought the presents and dropped them off because I think my ACEs score kicked in. It was too much, couldn't be there for it. So at least they have some little lanterns as night lights and a book and a toy and all that kind of thing to say that we love them and we're pulling for them. Today was the Clatsop Soil and Water District. I missed that one, but went to the CFEDC, and Commissioner Sullivan was there, Cliff Tuttle was there, good to see him. What we're looking at is getting ready for the forestry tour. And what is it, Cliff? October 12th, is that it? Sorry, September 12th. So September 12th. Kevin Leahy is coming, that's right, September, so it's, we hope it's not fire season. It'll be a good show. What we're looking at is the 30% of the Clatsop County revenues that come from the forest products industries, so that all the commissioners can understand the relevance of what those hardworking people do that provides revenue for our coffers, for us to appropriate and provide services for the rest of Clatsop County. Tomorrow is COLPAC, the Columbia Pacific Economic Development Region, and Northwest Act. All that's in Banks at the fire station. We'll be talking about the transportation plan. Michael Summers said he'd be there too, so Senator Johnson will be there. If you want a treat, you can come and hear her report.
That's tomorrow?
That's tomorrow, yeah. from 10. Craft 3's having an open house tomorrow night. I'll try and get to that, 4 to 6 p.m., 42 7th Street in Astoria. They're a triple bottom line bank, people, planet, profits. So they're looking at that ecological sustainability as part of how do we keep ourselves going and keep the planet healthy. So I want to talk a little bit. I did some research preparatory to coming tonight. Commissioner Nebaker, I'm sorry if I mess with your schedule, but I wanted to look at, wanted to do some research on the Clatsop Vision 2030 Together. You remember we worked on this, some of us. We went to all those community meetings. We looked at the things we love about our place. We looked at the things that matter to us, our vision focus areas, economy and jobs, arts, culture and history, health, safety and resilience, education and learning, environment, natural resources and recreation, community development and planning, and again, economy and jobs. Because if we don't have jobs for people, we don't have much. People can't afford to live here, people don't have houses, doesn't work. So we've got the long-term financial plan. It says the county commissioners, and I'm quoting from my orientation manual as a county commissioner. It says the county commissioners set financial goals and priorities with input from the citizens. And how does that input from the citizens come? Well, I think part of it, I have a list of the liaison activities that we all participate in. So we as commissioners have agreed to perform extra above and beyond sitting on this dais and conferring, deliberating together. We were talking just a little bit before the meeting tonight about how we can link those liaison activities with what goes on in our deliberations. Because I think it's important, but maybe I'm wrong, because I have the idea that the role of a county commissioner is not just to sit on this dais and not just to read the packet and vote. I mean, of course we're going to do that. But if we do liaisons with our community organizations, we should bring that back. We should integrate it to set the county's funding priorities, and we should implement those as we look at how we go forward as a board and a staff. Pardon me. I looked at the organizational chart. Here's the organizational chart, and we elected public officials come right beneath the Clatsop County citizens, and we supervise the county manager. That's our job. We supervise the county manager. So I looked through my notebook because I wanted to see what it said about that. It says, among its primary duties, the board makes laws, sets policies, adopts budgets, and oversees a wide-ranging agenda for the county. The board also monitors the activities of the county manager and the county council. It's clear, it's our job. We don't just set the policies, we monitor the activities. When I look in the board policies, Policy 5, Board Management Delegation, Policy 5 says, monitoring county manager performance. Systematic and rigorous monitoring of county manager job performance will be solely against the only expected county manager outputs: organizational accomplishment of board policy on ends and organizational operation within the boundaries established in board policies and executive limitations. Okay, so what does the ends policy say? It says, these will require board to focus and guide the county through the development and in subsequent years, the review of the strategic plan. So I've been talking about this board needs to develop a strategic plan. And I say that not because it's my opinion, but because it's required in our ends policies, which we've said are the way that we guide ourselves. I also noticed when I was looking here under county manager limitations, policy 6, emergency county manager succession. In order to protect the board from sudden loss of county manager services, the county manager shall not permit there to be fewer than 2 other executives sufficiently familiar with board and county manager issues and processes to enable either to take over with reasonable proficiency as an interim or successor. So I see that we have, as a board, in writing policies, because I'm an old-time bureaucrat, and I think policies should be written. So these were given to me when I came on board as a county commissioner, and I think it's, I think it'd be a good idea if we looked at these, did a review, and formed a strategic plan, because I think we're ready for that. I think that the chair's been leading us in that direction, and I hope that we can continue and come up with a strategic plan so that we can do our job as we've said we're going to in these policies. Thank you.
County Manager Moore.
I don't have anything.
Okay, thank you. Okay, it's seeing nothing else for the good of the order. The meeting's adjourned, and then we're going to take a couple-minute break.